One of the things that we noticed is the complement of women to men in our provider category, and we really started to work intentionally towards programs that called out specific women's health needs and ensured that we had the right folks to address those. And who better than a woman to address the fears or the concerns of other women within our organization or in our community? And is this someone that could carry our mission further? Is this someone who we could wrap our women's services platform around? How do we look at how we treat women in cardiac events, those that have untoward events in pregnancy that have lasting impacts, and there's not a lot of places to care for them. The other thing that we've seen is with women being the most reluctant to receive care because they put everyone else ahead of themselves, is having that call, having the provider that they can relate to. You know, we're very inclusive and very diverse, and we've been intentional about doing so that we can pull more folks in.
I've been a nurse since 1988, so a very long time. Started off as that. And traditionally in healthcare, you always see and think of nurses as women. And there are more men that are absolutely joining the profession. But when you look at roles and leadership and physicians, you typically think of males. And it was that way throughout my career. There were very few women physicians, but more so, very few women physicians in specialty areas like surgery, cardiologists, those kinds of positions that you think more of as men. And it's been great to see as, I've been growing up here in medicine that we have a lot more women, and it is a little more challenging because it is a very tough pace, and people still have those gender role kind of expectations of folks that you'll even have when you interview for positions. Is your husband okay with you working these hours and those kinds of things? And you have to just kind of stop for a minute and pause and smile and say, I'm my own independent person and I make my decisions, and I do discuss them with my husband as a family, but my role is not based on my gender.
Yeah, I think in my experience, I haven't experienced any difficulties just because of the women that came before me. Obviously, I'm younger in my career, and so it's much more common to see females in medicine. I think now there's more females in medical school than there are males. So I definitely attribute the hardships of others before me to get me to this point. But from a surgical standpoint, there's definitely still a lower amount of female surgeons, but it's rapidly becoming more and more equal.
Many people don't realize that heart disease is the #1 cause of death for women as well as men. So women oftentimes have jaw pain. They even have nausea, vomiting, thumb pain. It radiates down their arm, back pain even. And women are moms and busy and can't take time off to take care of themselves, and so they think that it is something completely different than heart disease or, a heart attack even. So it's very important for women to take time for themselves and go get checked out when something doesn't feel quite right.
I think women really honestly at the childbearing age should start seeing a physician, not just their OB-GYN, which traditionally in the past most women would have babies and then not see a doctor other than their OB-GYN for 20, 30 years, and show up in the 5th, 6th, 7th generation, haven't seen a primary care doctor in that long. And so nowadays, and I do a clinic with our maternal fetal medicine specialist, so I'm seeing women at a much earlier stage, like right after they've had babies and they've had heart issues or blood pressure issues of various sorts. And so I'm telling those women, listen, you need to be seeing a primary care doctor once a year. You got to see someone once a year, you got to get your blood pressure checked, you got to see someone who's just making sure, and if the answer is, you're doing great, well then fine, yeah, that's awesome, just come back next year. But let's not wait 20 or 30 years until we start doing good health screening, and because really it's all about prevention. I want to see you before you have a cardiovascular event, not after.